Over the last 2 months, we've basically done about 70 procedures, and we've done everything from carotid stenting, aneurysm embolization, arteriovenous malformation embolization. We've done a pipeline flow diverter stent. We've done several stroke cases, and basically the new machine has allowed me to save fluoro and contrast because of all of its different features, including the Innova 3D system, the blended roadmap system, as well as the digital zoom. Innova CT HD really helped us in our aneurysm cases and stroke cases. It gets me very good quality soft tissue CT, which is very important if I feel that the patient might have acutely ruptured, or if you feel that you might have perforated a vessel, you can do the soft tissue CT without moving the patient off the bed and saving a lot of time. One of the nicest features is digital zoom. It allows me to keep my image zoomed out where I have the guide catheter access. I can selectively catheterize my aneurysm with my microwire microcatheter with no difficulty. I think the biggest deal about the big screen is it allows you to use the digital zoom feature. It allows you to change your layout. If I want to have vitals up on the screen, if I want to pull up PACS images, if I need a different layout, if I want my live fluoro in a larger format and my reference photos smaller. The live fluoroscopy and the DSA image quality is very good, and there's actually multiple different settings that we have built in our machine. So we have different features for pipeline, or if I'm doing carotid stenting versus any intracranial work, I'm allowed to lower my radiation dose and still have very good image quality. Using the Innova 3D controls, we're able to do amazing 3D reconstructions of intracranial vessels. We can use the bedside controls to measure the aneurysm, rotate it, and I can actually send the angles using that bedside mouse to the machine, and basically will get me that view that I see in my 3D reconstruction. We also have a subtracted feature where I can do 2 spins and basically will subtract a coil or a clip that was previously placed to really get a good idea of what my neck residual is. And even if that is not up to my standard, I can drop in the clip or the coil to really understand what's left of the aneurysm and how much residual is left at the neck. As the cases we do get more complex, the radiation dose definitely affects me as well as my patients. The current protocols that we're using for the Innova system help me save radiation dose. If I feel that I need a little bit better quality for an arteriovenous malformation or an aneurysm that's very distal and we're zooming in, I can just change my protocol at the bedside. It takes me less than 5 seconds. Innova Vision is allowing us to do 3D road mapping, and it superimposes the roadmap over live fluoroscopy. We can change the screen layout to either be half the whole screen, a quarter of the screen, or the regular 6-screen setup. If we move the patient for some reason, or if the patient moved on their own, if I need a different angle, I never have to repeat my roadmap. It's always being moved with the patient, no matter what angle I move the patient to, or if I raise or lower the bed.